In this video, we will discuss about amblyopia, a condition that is observed in patient. And it is related to the eyes, as we can see that. So this amblyopia is a condition in which one eye is weakened, whereas other eyes remain or functional or function as normal. This this is sometimes happened the because of the habits that cause more effect on one eye, whereas it does not cause uh, that much effect on another eye, such as tilting of the head for a longer duration of time or making it as a habit. So that might leads to amblyopia. There are some other problems also that occurs within the humans, and that is related to eyes. So let us discuss that disease, that problems also. First one is astigmatism. So what does this astigmatism is? We will compare it with the normal vision. So in the normal vision, everything is perfect, everything is functioning normally, and the images are formed at the retina. Whereas in astigmatism, what happens is that the cornea is not in the sphere shaped as it is in the normal vision. The cornea is found in the oval shape, and this problem might be inherited from their parents. And because of this oval shaped cornea, what happens is that the images are formed at multiple point. One is before the retina, another is after retina, as it can be seen in this figure. Another problem that happens, that is more uh, observable within the population, is the hyperopia and myopia. And this hyperopia is commonly known as far-sightedness problem, and myopia is known as nearsightedness problem. So in the normal case, images are formed at the retina or at the focal plane, whereas in case of hyperopia, what happens is that images are formed after the retina. Because of this, the blur image is formed. Patient is able to see blur image, and these things can be after correction, hyperopia corrected lens. We can form the image at the retina. And in myopia, what happens is that images are formed before the retina. So we need to uh, increase the distance, or we need to change the focal plane to a point that images are formed at the retina, and this can be corrected with the myopia corrected lens, or we can say convex lens. And the hyperopia condition is corrected with the help of concave lens, as it will increase the as it will decrease the distance at which images are formed, and this convex lens will increase the distance at which images are formed, and so that the in myopia condition, images uh, can can form at the retina instead of forming images before the retina. So these are the commonly condition that is observed within the population. One more thing that is observed, and this hyperopia and myopia is also known as ametropia, and the reverse of this ametropia is ametropia, and in which case the eye vision is perfect, where images are formed at the retina, and that condition is medically known as 20/20. Let us come to this topic again. This final condition of this final eye problem in this video is about presbyopia, and this presbyopia is related to old age person. So it is basically the ability to correct the focal length is loosened. So whenever a old age person changes its vision from a far side to a near side, the ability to correct the images is weakened. So it might take more time for the image to correct it. So in order to correct this image, we use presbyopia corrected lens, or it is also a concave lens, so that it helps the human beings to form the image retina at the retina in a short duration of time, or we can say instantaneously. And the main problem in this case that has been found is that the with age the lens is becomes hard in shape, so that the flexibility loosen up. that that could that is the main reason for this presbyopia problem. So I hope you have understood different kind of eye problems that are found within the human beings. If you need to understand this thing in details, you can go through the reference that has been provided in the description. That's all for this video. Thank you for your time.